Today in this lecture, we will continue our discussion on progressive shock, the different factors and feedbacks which are basically involved in progression of shock. So far, we have discussed some of the factors, some of the feedback mechanisms which basically leads to progressive shock. We discussed cardiac depression, we also discussed vasomotor failure, and we discussed the blockage of small vessels during shock. Now these factors we discussed, they basically lead to more positive feedback mechanisms which leads to further increase in the shock, and the shock basically progresses, or shock basically breeds more shock. Now to remind you, shock is a condition in which the pumping of the heart is such that the tissues, the cells of the body are unable to receive sufficient amount of nutrients, oxygen and other important nutrients to fulfill their needs. So any condition with inadequate supply of oxygen and other nutrients to the body tissue will be considered as a shock. Shock we divided into three stages. The first stage was non-progressive shock, which we discussed in detail. The second stage is basically progressive shock, and the final stage will be irreversible shock. Now in the progressive shock, there are some important feedback mechanisms or some factors. Three of them have been discussed in detail: the cardiac depression, the vasomotor failure, blockage of small vessels, for which you can watch the previous lectures. Now coming to the fourth factor, the fourth feedback mechanism which basically progresses the shock more, is the increased permeability of capillaries. Now here we see blood from the body is basically returning to the right side of the heart. The right side of the heart basically pumps this blood into the lungs, where the blood basically is oxygenated and returns to the left side of the heart. Now the left side of the heart pumps the blood into the tissues, and the tissue basically utilizes the oxygen, and then the deoxygenated blood returns back to the heart. Now what happens that in shock, when the severity of the shock is very high, the capillaries, the small blood vessels, basically their permeability increases. There is increased permeability. Now when the increase in permeability, the fluid coming out of the capillary increases. Now because the arterial pressure has fallen in the shock, or the supply of, maybe the arterial pressure is normal, but the supply of nutrients or oxygen has fallen to the tissues and cells, due to which there is release of some substances which increase the permeability, which increases the permeability of the capillaries, so that the body is trying, the tissue is trying, the cells are basically trying to receive more nutrients. So they release some factors which leads to increased permeability of the capillaries. Now due to you can see the hypoxia and the decreased nutrients causes the increased permeability. So it is the decreased supply of the oxygen and decreased supply of oxygen which is considered as hypoxia, decreased supply of other nutrients, they lead to the increase in the permeability. Now once the permeability of these capillaries have been increased, then what happens is that fluid transudates into the tissue. Then more fluid it transudates into the tissue. Fluid starts transudating into the tissue, more and more fluid is coming out of the circuit. Now this is the closed circuit. This is a closed circuit in which basically the blood is circulating in a fixed volume. Certain amount of volume of blood is going into the tissue, and certain amount of fluid is coming back. So the volume circulating and the blood coming towards the heart and the blood pumped by the heart, the volume of that amount is more or less the same. But due to increased permeability of the capillaries, there is more fluid coming into the tissues. It is coming out of the capillaries, it is coming out of the closed circuit, it is coming out of the circulation. So this fluid that is transudating into the tissues is not available for circulation. So there is a decrease in the venous return. The amount of blood that is returning to the right side of the heart, it decreases. So it leads to decrease in cardiac output. When the cardiac output decreases, there is further decrease in the arterial pressure. When there is further decrease in the arterial pressure, there is further hypoxia. There is further decrease in the supply of nutrients to the tissues. There is further release of toxic substances. There is further increase in the permeability. There is further cardiac depression. There is further failure of the vasomotor system. There is further blockage of the vessels, and there is that vicious cycle. It keeps on increasing, and the shock basically keeps on progressing. And that's why it is labeled as progressive shock. And this increased permeability of the capillaries due to hypoxia and due to decreased nutrient supply is one feedback mechanism and one factor in the progression of the shock, or in increasing the staging of the shock or the severity of the shock. Now another important factor is basically release of toxic substances by the ischemic tissue. release of toxins by the ischemic tissue. And the toxin, when there is decreased flow, of nutrients and oxygens to the cells and tissues, then apart from substances which basically lead to increasing the permeability, there is release of some toxin substances like histamine, serotonin, and tissue enzymes. So the purpose of all these substances, the purpose of all these mechanisms is basically to increase the supply of oxygen and increase the supply of nutrients. So as long as the patient is a condition of shock, as long as there is inadequate supply, these conditions will keep on occurring. These conditions, these factors, these feedback mechanism will keep on increasing, and a vicious cycle will continue to develop. Now, the important thing is progressive shock can be recovered. It can be stopped with the help of treatment. So therapy can basically reverse the progression of a shock. So therapy is helpful. So at some point, if the condition, for example, blood loss, which caused the shock. For example, trauma occurred, accident occurred, due to which there is a lot of blood loss, or in diarrhea or vomiting, there is a lot of fluid loss. The condition which basically led to the shock, if that condition is properly treated, these conditions can be reversed up to some extent. But if the progression of shock occurs and there is the irreversible stage of shock comes, or if the shock enters the third stage, the irreversible stage, then the treatment won't be helpful. Now, considering the sixth factor or the sixth feedback mechanism, which is also involved in the progressive shock, it is basically the release of endotoxin. Now, these toxic substances, now the histamine and serotonin, they may not be toxic in all the every time. They may not be toxic in every condition, but in the state of shock, when they are released from the tissues, they may act like toxin. No, they are not toxic all the time. They may be helpful sometime, but in the state of shock, they are considered as toxin because they lead to the vicious cycle of progressive shock, and they keep on progressing the shock and increasing the severity of the shock. Now, these toxins were released by the ischemic tissue. But there are some certain toxins which are the endotoxin. They are basically released by bacteria. And the gram-negative bacteria. Now, basically, the endotoxin will lead to cardiac depression. So, we discussed cardiac depression, and that cardiac depression was basically due to inadequate circulation, and it also helped in the progression of the shock and increasing the severity of the shock. But if shock is not treated, or if the shock is very severe and the shock keep on progressing, then what happens is that there are some bacteria in the intestine. Suppose, for example, this is intestine. Now, blood flow to this intestine, it is decreased. When the blood flow to the intestines is decreased, due to decreased blood flow, there is a release of endotoxin from the gram-negative bacteria in this intestine. So the gram-negative bacteria, they are normally present in the intestine, but once there is a decreased blood flow, they will basically release the endotoxin. Now, these toxins are different from the toxin released by the tissues. They are basically released by the bacteria, the gram-negative bacteria. And what these endotoxin will do, that they will increase the cellular metabolic level. They will increase the cellular metabolism. Now, these tissues, these cells, they are not receiving proper amount of oxygen and nutrients. They are not receiving the proper amount of oxygen and nutrients. On top of that, there is release of endotoxin due to the decrease in blood flow to the intestine. Now, these endotoxin will further increase. They will further increase the metabolism. Of these tissues. So when metabolism increases, there is increased demand of nutrients and oxygen, but the body is in a state of shock, and the heart cannot basically fulfill the existing needs of the tissues. On top of that, there is release of endotoxins, which basically further increases the cellular metabolism. So the cardiac depression basically increases. The heart cannot fulfill these demands, due to which there is further deterioration of the cardiac output, and cardiac depression occurs. So these are the 6 factors. There are some other factors which we will discuss in the coming lectures, but these are the factors so far which we have discussed in the progressive shock. Progressive shock is the increasing it occurs in the with the increasing severity, and it is the second stage of the shock, in which shock keeps on increasing, and some shock basically breeds more shock. So it's basically progressing, but this shock keeps on increasing due to certain factors. First factor is the cardiac depression, which we have discussed in detail. When the supply of blood to the heart is not sufficient, then this condition occurs. Now, the other factors which basically contribute to progressive shock, they simply include the failure of the vasomotor center, the blockage of the small vessels, increased permeability of the capillary vessels, release of toxins by the ischemic tissue, and finally, release of endotoxin from the gram-negative bacteria in the intestine. Thanks a lot for watching the video.